Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is part of the Nursing Faculty Prep webinar series, sponsored by Lecturio. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. This webinar is proudly sponsored by Lecturio. Lecturio's products and services help nursing students learn to study effectively while empowering educators with valuable and actionable performance insights. Discover how Lecturio can enhance teaching by visiting their website, lecturio.com/sigma. We'd like to thank our speaker for sharing her expertise again with us today. Our speaker today is Dr. Rhonda Laws. Dr. Rhonda serves as an active faculty in the Bachelor's of Science in Nursing program and is the Chief Nursing Officer of Lecturio. Dr. Laws has over 30 years of experience in nursing, more than 20 years of experience in higher education, and a PhD in educational psychology with research emphasis on academic resilience, self-efficacy, mindset, and best practices for teaching and learning. We're so thankful to have you today, and we want to turn it over to you.
Hello, everyone. We're going to switch. We had a couple technical difficulties, so we're going to switch over just a little bit. So give me a second. Welcome. I saw people from Texas. You're really close to me. Maryland, I was at a meeting for you last week, and I got to spend an extra day due to flights being knocked off. So I really enjoyed your state and even an extra time when I got to be there. So let me start with this. And I love seeing where you all are from. The next time I'm going to see if I can get this slide up. We are in business. Okay. Hey, it's really important that you do a couple things. I would love for you to get something to write with because I want you to take notes. This is a working session. I personally have a very short attention span. So I want to engage you guys and give you something that you can walk out of here with and use in your classes really quickly. So that's my goal. So we're going to talk about learning objectives and why those matter when you're writing questions. We'll have question samples. We'll talk about the next gen, which you've heard a lot about. So my focus in this session is not going to be on explaining the questions. It's going to be how do you write the questions. Now I'm going to show you 2 case studies. One is a patient who has hyperglycemia. Another one is about infection control procedures. And then what I want you to write is I want you to actually write a study with me. So grab something. This will be just a quick and dirty one as you're going through it, but you can go back and put the finishing touches on it. Because if you're spending this much time with us, we want to make sure that you get really practical, helpful things out. So let's get rolling, grab something, and I'm going to show you how we're going to walk through that. You've got the learning outcomes. We all know how to do that. But I'd like for you to write in the chat for me. Can you answer this question? Have you attended an NGN item writing workshop before? So just type a Y or an N, save your energy, just a Y or an N to let us know. And I would imagine as colleagues, we're all over the map with this. Some of you have gone to every NGN writing thing that you could, and others is maybe the very beginning of your journey. So we appreciate you just kind of letting us know who's here. So let's start with the ugliest, right? The NCLEX pass rates. As you know, they're going in the wrong direction, right? You can see that our pass rates are going down and down. And of course, it is, don't even need to say it today, but wow, we're all worried about it. Now, I am the CNO of Lecturio, but I am also in the classroom, and I am biting my fingernails waiting to see how this class does this year also on NextGen. So we're all in the same boat. In fact, yesterday I just finished an item analysis late last night for one of the exams that we gave. So all of us are in the throes of teaching students, and we want them to be prepared. And if you're the kind of educator that comes to a session to learn how to write test items better, you are my people, because you are taking your time to make yourself a better, stronger, more effective educator. And I love it. If you're a seasoned person, you've written tons of questions, then maybe you'll pick up some pointers here on how you can help your colleagues. Because trust me, when I went from the bedside to education, it was quite the transition. It was bumpy, bumpy, bumpy. Didn't understand all these things, and it felt really overwhelming. So if you're in a place where you can mentor people, oh, please do that, because we need those type of faculty colleagues. Okay, so NextGen NCLEX, we all know what that is. We know things are coming, but I just wanted to give you this quick review in case you're a little rusty on this, because they keep changing it. Because COVID and all the problems that we've had. I remember it's been 6 hours for as long as I can remember. And now time limit has changed. The number of items has changed. Here's the one you really are going to be interested in, though, is like, if they take the minimum amount of questions, every student is going to get 3 case studies. Okay, so, and we put 18 items there because each case study has 6 different types of questions in it. So that's kind of the outline that I want you to write for yourself in your particular topic. So whether you're pharmacology or women's health or acute and chronic illnesses or care management, whatever it is, I want you to come up with an idea that will work in your classroom. Now, if you really want to get down to the nitty gritty, there's going to be 52 to 117 standalone items. The scored items are 7 to 135. The unscored are 15. I mean, the most important things for your student is it can be 85 to 150 in 5 hours, and you'll get a minimum of 3 NCLEX case study type questions. Okay, now just as a really quick review, we're going to throw some ugly words up here for you in abbreviations. They're kind of funky, but this is the language of NextGen NCLEX. So we're not going to go over exactly what each of these look like. I just wanted to put, at this point, I just wanted to put the words up here so you know, like, these are the different types that are coming. Now, the next slide is really cool. This is something that I keep on my desk. So when I am writing questions, I have this as a resource. So you'll see here that this tells you, depending on in level 3, there are those 6 elements, right? Recognize cues, analyze cues, prioritize, hypothesis. This is the clinical measurement model that the new NCLEX is written off of, that our students are already taking if you had graduates in March. So I want to show you, like, if you're going through in your classes and you want to really emphasize element 3, let's talk about the kind of questions you should use that will help you prioritize hypothesis. But we're not going to start at number 3. We're going to start at number 1. So which types of questions would be good for step 1? Recognizing cues. You see it there. What about analyzing cues? Okay, so all the way through, we broke this down. So it's just a quick sheet, because, you know, sometimes at the end of the day, I do not have a lot of brain cells available. I don't have the bandwidth. So I don't want to waste my time trying to remember what type of question would be the best. As you use this more often, I don't have to reference it as much, but this is killer. Having this available to you is going to make your brain more available when you actually want to do the important things like write the questions. Now, when you're writing a question, it's all about the objective. What do you want that student to learn? So if you just had to think about right now, I want you to start thinking in your course that you're teaching, what is one thing that you're pretty comfortable with, or you feel students struggle with, that you would want them to learn? From your course content, just pick anything, because I want you to create a learning objective from that. You know, if it's something, if you're thinking about QSIN values, you want to think about those KSAs. If you're thinking about what you want them to learn, what's the focus? Like if I was teaching CHF, what is the thing I'm going to zero in on? Am I zeroing in on them recognizing the patient is in fluid volume overload when they hear crackles? What is it exactly I want to focus on? So start your wheels turning, jot some things down. It'll be much easier for you to remember how to write these questions if you actually go through the exercise with us together today. Now think about the various categories. You may be teaching to a certain category in your class. You may be teaching to leadership management, and that's a lot of care management questions. These are the things I want you to be thinking about. Now, at our company and many of the companies, we categorize all the questions. So they're categorized for CUSIN, they're categorized for NCLEX categories, they're categorized for the new BSN essentials. But if you're doing the work of writing your own questions, you should do that too, because that way it's going to make when you're reporting for accreditation so much easier, and your dean's going to be super impressed with you. Now, make sure you know what you're measuring. You want to make sure that the outcomes are measurable. And think about a test blueprint. That's a pretty common practice. Not everyone does it, but it really is beneficial. It holds you to be accountable and helps you stay honest, that you know what you're trying to do with your students. You know what topics are most important. So I don't do study guides in my courses. The objectives for the module drive the test. So, and I give them an exam breakdown, I'll tell them what percentage of the overall test this objective is, and this objective is, and this objective is. And then I use all those objectives for my test blueprint. So it all ties together. And that way it keeps me honest, and I know how much I need to make sure that all of those objectives get covered. I know when I was teaching pharmacology, I would tell them every year, guys, this is how I do the test blueprint. And when I had students come in, they'd be like, listen, when Prof Laws tells you there'll be a question from each objective, there will be a question for each objective. So that was my street cred, is that we stuck to it. And if they use that as a test plan and use it to study, we should all be on the same page, and we're getting better and accurate assessments. So if you had to pick a letter, what is your current percentage of comfort level? Is it A, B, C, D, or 81 to 100%? You're going to be a mentor. You're just here to learn how to help other people. So if you wouldn't mind, just put it in the chat so that we can all see where we're coming from. Because I want everyone to know, I bet we are all over the map with this. Okay, so pop it into the chat. And as you're doing that, I'm going to start talking about the case studies. Now, there's 3 case studies that are most important in this section. 1 and 2, I'm going to show you, so you see different examples, but number 3 is yours. Okay, so I'm going to have 1 hyperglycemia, 1 infection control, and then the 3rd one is pick your own adventure. So pick a topic that's within your expertise, and you're going to walk out of this with a case study ready to finish up when you're done. Okay, so let's talk about an outline. Whenever you're writing a case study, this is a brilliant first step. Okay, so this helps kind of calm your mind. Just like we teach students to be systematic in how they take questions, we should be systematic in how we write them, particularly when we're tired at this point in the semester. But here's a quick outline for you. Just answer these questions. These are 5 quick questions about your case study. Just jot down some quick notes about history. It's not going to be complete. You're just giving yourself enough notes that you can go back and finish when you're by yourself. So history, what meds do you want on there? Do you want vital signs normal or abnormal? You can even jot some signs. What complications are potential there, and what is treatment? So I'm going to give you about 20 seconds to kind of jot that down with quiet. Okay, now I want you to think about writing out the objectives. I want you to write out, like, what do I want them to learn? Okay, what are the things I want them to learn? Like, what would I want them to watch for in history? What type of medications? Just jot yourself some quick notes, just real fast. What would be what you want them to get out of each section? And this is going to make writing your story so much easier. Okay, so just take about 10 seconds and jot some quick notes to yourself. Now, you're likely a perfectionist, because those would be the types of folks that really get into item writing. Give yourself grace. You just want some notes here to understand the process. We're not looking for a perfect case study, we're looking for you to have understanding of how you can continue to write these when we're not all together. Okay, so you've got some notes there. Don't sweat it. If it's not all completely filled out, I would not expect it to be. But this is going to be who we have for the first case study. This is the hyperglycemic patient. This is what we're looking at. So what I wanted to do in this case, and is I wanted to, and I forgot to give credit at the beginning of this. So I want to be sure to go back and do this. The head of our item writing team and our company is Dr. Becky Oglesby, and she is the one who originally created this presentation. I just get the pleasure of being with you today and sharing it, but I wanted to make sure that when a colleague puts this much work into something that they're recognized for their effort. And so this was Dr. Becky Oglesby. Her name's on the first slide, but I wanted to make sure to point that out because no educators get enough credit for all the effort that you guys put in, so I would not want to do that to a colleague. So we picked a hyperglycemic patient. What I want them to learn roughly, here's my big goal, I want to be able to recognize and to manage a client who has a high blood glucose for type 2. That's my goal. So it's pretty big. I'm not saying specifically, is that meds? Is that checking their blood sugar? Is that diet control? Nothing is that focused in there yet. But I'm going to go back and write a little bit of a story, right? Because I've had those slides in the beginning where I thought through those 5 questions. So you have them on your notes. And now you're thinking about, now let's kind of start to begin to write a story. Now you can see mine here. Mel presents with a blood glucose of 355, reports blurred vision, headaches almost every day, and either takes ibuprofen, naproxen sodium, or acetaminophen. Now they've got hypertension, they take antihypertensives, they've got a diet of fast food during the day with soda several times a week, BMI of 55.4. Okay, can you imagine what our students feel like when they read these questions? A great strategy that you can help your students be prepared for NCLEX is to teach them how to break this down. Now, we can't teach test-taking strategies today, but helping them be aware that these questions, even though we're trying to make sure it's only helpful information, can become quite long. And if the student is stressed, and who isn't stressed on a test, they need a way to focus their brains. So you want to teach them the strategies about what they should look for, what is key information, encourage them to use their write-on wipe-off board that they'll get when they go to take the NCLEX to help themselves take notes kind of as they're going through. So you'll see here, we've got this story, and we've got the home medications that they're on. My goal here today is not for you to get the right answer. My goal is just for you to look at, here's an example of what we put together for a case study. And I want you to use that to guide you as you're putting your case study together. Now, the second case study is infection control precautions. So this is a 50-year-old man who is admitted for acute cholecystitis, and the pains level is 9 out of 10. They've got visible jaundice. This is what is seen in the nurse's notes, like we would see in a real NCLEX and next-gen format, because you'll see on the question, you've got the tabs and where that stuff will be written, got the vital signs and the lab. Okay, so far, you have written just a brief 5-question kind of outline of the things that you're gonna hit and cover in your case study. Now you started thinking about, what is the story of my patient? And what other information do I want in there? Vital signs, lab, medications. You just have some quick notes, because this is where we're drilling down. This is the part of the NCBSN clinical judgment measurement model where we're looking right where that blue triangle is. Those are the elements that we're going to be talking about. And this is how you build a case study. So we're going to look for ways, how can we test if the student can recognize cues? How can we test if they can analyze cues? Test if they can prioritize hypotheses, generate solutions, take action, evaluate outcomes. That's what we're going to walk through in this 6-part case study. Remember, all your students, even if they're the rock stars that shut it down at the minimum, are going to get 3 of these. So you want to make sure when you're helping them practice that you're giving them lots of opportunities to break down these case studies. So it's difficult for them to focus. So all the strategies you can give them to help them stay focused when they're taking these, you're going to be the faculty of the year. So this is the model that we're referencing straight from the NCSBN website. So that's the reference for this one. But let's take a look at that first element. Now, see if you can remember what is the first element. Just say it to yourself. Recognize cues. Okay. One thing I really love about this next gen is like, these are the kind of things we try to teach our students in clinicals and in the classroom, but particularly in clinicals. Hey, when you walk in and you're having a conversation, you should be scanning that patient head to toe. When you're helping them up, look at the skin on their back. When you're giving them a bath, we're always asking them to be watching for cues. Don't just wait till something is way off base. We want them to be early in catching cues that they should be seeing. So that's what element one is. It is to recognize the cues. So you'll notice I have a little friend right up there at the top. That's a squirrel, because it's very easy to get distracted, both when you're taking a test or when you're writing exam questions. So I put this little squirrel in. You'll see him pop up in different places because I want you to keep in mind, you've got to keep your eye on the objective. What is the goal for this question? Now, you kind of wrote a general one right back there at the beginning, but you'll see this little squirrel pop up every time because I want that to trigger for you to ask yourself, am I really focusing on the objective of this question, what I wanted to test them on? Because it's so easy when you're writing a case study to go down bunny trails. And if you have the attention span of a gnat, like I do, it's super easy to make that happen. And you want to go all different places, but keep your eye on the prize. Make sure that you're very clear on what the objective is of this case study and that you keep your eye on that. You want to make sure in this first step, our goal is, can they just recognize normal and abnormal? So you guys that are patho-pharm people, love you. That's one of my passions. But you made sure that you taught them, again, normal and abnormal and the treatment of medications in it. That's what you want to think about in your step one. So for your case study, I want you to think about normal and abnormal. What things would you want them to come up with? So just jot yourself a note, element one, normal or abnormal. That's what we're looking for. Now, this would be assessment data. If it was case one, it'd be about the hyperglycemic patient, right? So this, we're trying to get them to see what normals or abnormals should the nurse notice. So here's your cue. When you're writing a case study, in step one, we're doing that first part. What normals or abnormals do you want your student to recognize in your particular patient's case? Now, I'm going to tell you an example of what we have here, but here's some options. You want to be thinking about, is it maybe their mentation? Is it breathing? Is it their heart zones or ECG? Is it neurochecks or blood glucose? What is it? Now, I use this check sheet for me because it just helps focus my brain and helps me study, and I think through normals or abnormals. Here's some good examples. You could write even additional ones if you want to do that to kind of help your patient or your students think about these things as they walk through. But for you, having a list like this, and this just gives you options and ideas, it'll give you inspiration, and it will be a much less painful process for you because you keep that objective in mind. I've got a list of things that I look at. I've got a second list of the things that I look at. And I think through these when I'm thinking about, hey, what normal or abnormal goes along with what I'm trying to test these students on. Okay, so that's a great time saver to have that list of those right available to you so you can do it. Okay. Now, also, I'm going to let you know you are welcome to put comments into the chat. Because of the way we have things set up here, I can't necessarily see that right away, but I'm going to trust that we have a whole staff of team of people with Sigma that can help keep track of those questions, and I'll definitely answer them, I promise, personally and individually. But just want to let you know, if you're writing me a note in the chat, I may not see it with our current setup. Okay. So this element one, recognize cues. We've already talked about what's the abnormal normal assessment. You've jotted down some quick notes on your example. So if you haven't, take a second now and write down some normal or abnormal assessments. If you want to see my list again of the complete ones, here's a great starter place for you. Just pick 1, 2, or 3 of those that you want to kind of consider when you're writing this in element one. Now, the next decision you're going to make is, okay, what type of question? And I told you, I get decision fatigue. That's why I use this cheat sheet that tells me, okay, if I'm doing element one, these are the 4 options I can pick from. And I can decide right then which type of question do I want to use in this first part of a 6-part case study. Okay, so you can choose which one you want there. Some of you are going, I don't know what all those letters mean. Don't worry, we'll help you know what those are. Like DDC is drag and drop close. DDR is drag and drop rationale. When you see the big D and the little d, that is drop down. So big D, little dc is drop down close. Drop down rationale is big D, little dr. Drop down table, big D, little d. So you kind of get the idea. But we'll have a whole list of those for you. For right now, it's just important that you know, like, hey, it's pretty set on which questions are the best in each one of these elements. And you can just use our sheet and not have to think about it. Much easier. Because remember, this is where we are. We're in that third layer that starts with recognizing cues and goes all the way to evaluate outcomes. Right now, we're still in element 1. Okay, now this next thing I'm really excited to give you because this is gold. To have this right here, these are the things that I know are that last sentence of the question. So take a look at these. Which of the findings require immediate follow-up by the nurse? Which assessment findings concern the nurse? The aspect of the client's admission history that is concerning to the nurse is, and we'd use that for a drop-down close, select the 3 findings that require immediate follow-up. That would be an example of an ending statement for a multiple response that tells you the number of questions, and then click to highlight the findings that require follow-up from the nurse. Okay, that's a highlighting question. But how you can use these when you're writing your questions is use these. This is NCLEX format. This is how you'll see the language of NCLEX Next Gen questions. So the bolded ones, there you go. Just pick one of those that you want to go with that lines up with your questions. Now you see we have the lighter things there. So those are ways that you can ask yourself questions. If you decide you want to do which assessment findings concern the nurse, you want to ask yourself, which additional information will they need? Which assessment do they need? If you want them to answer a question that says what requires immediate follow-up by the nurse, then you think about, okay, which one is unexpected or modifiable, which are non-modifiable, just to make sure you're writing a clear case study. So this question, you can do lots of things with this, but with this right here, you can teach your students how to be better at reading test questions because you help them know, like, when you see which findings require immediate follow-up by the nurse, that means you're looking for the thing that puts your patient most in danger. So for this particular patient in this particular setting, what keeps them the safest? That's the one that requires an immediate follow-up by the nurse that you need to intervene. Now, this seems like common sense. Like, don't nursing students know this? No, they do not. It's a real struggle. And I've taught NCLEX reviews for about 20 years, and this still really freaks them out. You would hope by the end of nursing school, they would have this down pat, and most of them do. But helping them explain, like, guys, I'm going to give you the rules to the game. Here you go. So for you guys to write questions, you've got them right there. For students to take questions, you can help them understand what this will look like and what they're looking for. Because it matters if they're looking for the thing that's the most safe or if they're looking for the thing that's incorrect. If you have a statement that says, like, which requires follow-up teaching by the nurse, I'm looking for the thing that's wrong or unsafe. Okay, so we're still in element 1. We're doing great on time, so stick with us. We're talking about element 1. Let's take a look at that first case study. Now remember, your goal is not to get these questions right. Your goal is to see the format and to start to apply that to what you want to do. So I'm going to show you a drop down close. Pretty exciting stuff there. That's what they look like. You guys have all, I'm sure most of you have seen these. If you haven't, we've got other resources for you at Lecture if you want us to share those with you. Now, the objective, I want the student to recognize the clues that relate to causes and results of hyperglycemia. That's my objective. Remember at the beginning, my overall goal was I wanted them to manage a patient with hyperglycemia and who's type 2. But right here, what I want, because you want an objective for each of the 6 parts of your case study, what I want is I want the student to recognize cues that relate to causes and results of hyperglycemia. So look at your case study. What objective would you want for this first part? Remember, we're looking for recognizing cues. So you're thinking about what cues will be most important for your student to recognize for whatever the topic or objective is for your case study. So for this one, because it's case study 1 and it's hyperglycemia, which I keep saying that, you would never have that title on an exam because that kind of gives it away, but just to help us stay oriented on what we're doing. So how you will see this in this type of question, the question will look like this: the client's admission and physical information that is most concerning to the nurse is 1, 2, and 3. So you've got those blanks there. On each one of the blanks, when the student clicks on that, there'll be a little drop down arrow. That's the close part of this. And you see that they have options there. Again, doesn't matter that you can see what the options are. What matters is that you help your students recognize this is the type of question you're going to see, and how do you want to break this apart? Well, go back to that story and what you have from your patient and think about what are the cues that should tell me something's going on. Gosh, if we could just get students to focus on normal from abnormal, you're going to get a lot farther in both our teaching and building their knowledge and synthesizing. So here we go. You've got it here. You've got your text. We chose a drop down close, which means in this one we have 3 options. So as you're writing your question, we have worksheets that you can download. You can also just do this on an Excel spreadsheet. But for space 1, you want to have 3 options for them to look at. So they can choose from these. And again, this is what we just did to make it easier for you to see, because it's very hard to see those tiny letters. But in space 1, it would be in options of 2 years history of diabetes mellitus, daily diet, or daily use of pain medication. Don't get lost in what you're doing, but think in this case study, I want you to think about what would be the best for your case study. Now, this one, I'm going to put the 3rd space there. And what you're thinking about is I'm looking for something abnormal that would also be hyperglycemia. And you're going to hit this wall. Sometimes when you're writing a case study, you think, oh, I've got 2 and I've just got to get that 3rd one. Well, if you're really on it and you want to guess, that's excellent. So try and see if you can come up with an idea for this case study. But what I'm really most interested in is you just writing down 3 spaces for your first recognized cues and just come up with 1 set of options. You can write the other 2 later. Okay. For this one, you could have done BMI, but again, I don't really care if you get this case study down. I want you to get the format. So while you're writing your case study, make sure you have just like 1 set of 3, kind of one correct answer and 2 distractors. And write yourself a note that this is a drop down close. Okay, now let's take a look at this with the second case study. This one was the infection precautions, and you're looking for standard precautions. This is what the objective is on that. This is how the question is written. Now look at that last sentence. Remember, that's the slide you're going to use to both write your questions and teach your students how to take questions. It says, click to highlight the correct section. So we know this is a highlight question. You likely don't have the ability to do this in a lot of your learning management systems yet. So this is just to help them know that this is coming up and this is an option. You likely won't be able to write one of those, but it is something that you want your students to be aware of. So you can write it, you just may have problems with the delivery. I know that a lot of the review sessions, including us, we have the ability for you to do that, but I haven't been able to do it yet right now I'm teaching in Brightspace and don't have the ability to do that yet. So back again to layer 3, I'm just reminding you where we are, because both with our students, a scaffold and helping them be reoriented, it cannot be oversold. You've really got to remind them of that, particularly when they're taking in new information. When you think about cognitive load, how much is going on in your brain and all the other things you're trying to juggle, know that students are just as tired as we are. Sometimes I think we're a little tired, but more tired than them, but they've got a lot going on in their brains. So as much as you can keep driving home why you're talking about what you're talking about will help them put information in their brains in an orderly fashion. So this is element 1. We know that's recognized cues. We know that this is on the judgment measurement model. So we're looking at that. We've got it laid down. We know what a highlight question would look like. Again, I know that you wouldn't be able to do that in your LMS, but a lot of the other systems and products are able to do that, including ours, of course. So we've finished level 1 with my example case studies. What do you have down for yours? So let me give you just 20 seconds or so to write yourself some quick notes of things you want to remember. Okay, now we're going on to element 2. Again, that's the next one after recognize cues is analyze cues. So let's take a look at that. Now, find our squirrel friend. He's there again. But the objective in this one for these examples is we're going to identify conditions that are associated with the signs and symptoms the client is experiencing. So it refers back to step 1. It refers back to that first part that you just wrote. So think about the abnormal elements that you put in element 1. What were the abnormal assessments? Now, this is going to tie into that, which what's most concerning, what puts the patient most at risk for complications. Maybe it even matches several other conditions because there'll be questions where they have to sort all that out. But these are the questions that I ask myself when I'm writing the second question for my case studies. So what was abnormal in element 1? Which one's most concerning? What puts them at risk? Are there other things I want in there to be kind of distractors? And am I still staying true to what my original objective is? Remember, you have the big overarching objective, and then you should have an objective for each one of the elements. Okay, so we're looking at that. What are the questions that we recommend that you do? There you go. These are the 4 of the 5 that we would recommend of those types. And here again are the types of questions I ask myself when I'm writing element 2. Which assessment findings most concern the nurse? Now, I think that's going to come from the abnormals that the nurse is supposed to follow up on. Based on the symptoms or information, is there a disease process occurring? And then for each of the assessment findings, click to indicate whether the findings from the client's assessment are associated with blank, blank, or blank. That is when you're going to see that matrix, right? And you'll see the 3 diagnoses across the top, the symptoms or cues along the left-hand side, and they have to click which one of those it is in. Is it in one of them, 2 of them, or all of them? So that is much tougher than a 4-option multiple choice. And the way you write these is think about, what did I write in element 1? Can I make a question like that in element 2? And these are the questions I use when I'm writing these types of questions to help me stay focused, make sure I'm on the right objective. So we'll have these available. This recording will be available. You can't write all this down as you're going. And also, I hope you'll keep in touch. We'll be doing more things like that, and I'll give you my contact information at the end of our presentation. So we're on element 2, right? We've talked about that. We've talked about, now we're going to do an MMR, which is, not a vaccine in this case. So what my goal is, I want the students to determine if conditions are associated with the signs and symptoms they had in element 1, or are they similar to hyperglycemia? That's what I'm looking for in this first case study. So the question text is, the nurses reviewed the labs with the admission data. So now you're going to take a look at, for each assessment finding, click to indicate whether the findings from the client assessment and labs are associated with stroke, hyperglycemia, or hypertension. Each finding may support more than one condition. Okay, so while you're looking at this and while we're kind of talking through this first case study, try making something like this for your case study. I want you to think about what are 3 kind of similar diagnoses that would tie in with your case study. And then just write 1 or 2 symptoms. Okay, so that way you'll know when you go back, you'll know you need to either add more, you didn't come up with 3 things, or you needed to add more symptoms that you want them to think through. You can go back and do that later, but I'm going to give you, again, 20 seconds to kind of jot some notes.
Rhonda, what's the difference between the bold and the non-bold?
And on our slide?
Yeah.
This is just how we're doing this. This is to tell you that that's just a heading. So
Perfect.
Objective is what we're doing, and question text is what the question would be. Yeah, that's not next gen. That's just us helping you think through. Thank you, Linda. Okay, this is what it will actually look like. So if you want to make quick hash marks on yours, you can. You don't have to. But here's the assessment findings. Now, we left a blank there if you wanted to fill that in. For what we're talking about, I would also go with like visual disturbance. So I have 6 possibilities of assessment findings and 3 diagnoses. That's how you're going to want to write yours. 3 across this way, 6 down this way, and the students will have to pick if is it 1 of them, 2 of them, or all 3 of them. Okay, so for case sample 2, how would we do that? Well, this is standard precautions, or what are we going to do for precautions for this patient? Same kind of concept. If we're talking about standard precautions, an easy way to do it is compare standard, contact, droplet, or airborne. But this just shows you another example of how you could use that. So you see we've got the types of infection control procedures on the across the top, and on the left you've got interventions, multiple interventions that they have to check. This question would be a student's worst nightmare, unless your questions are really, or your students are really good at this. Usually this gets a little tricky for them, but if your students shine on this type of question, you should congratulate yourself and your program. When I've taught NCLEX reviews, they hate this type of question. Okay, so you've moved through element 1, right? We did normal and abnormal. We're in element 2, we're referring back to element 1. Then we're referring back to recognizing cues, and we're asking them to analyze them. These multiple matrix response questions are a great way to do that. This really demonstrates if they can sort through all that information. So you're at 2. Now we're going to go on to element 3. That is prioritize the hypothesis. So we're still on that same spot, right? We've just moved to the 3rd box where that blue triangle is that says prioritize hypothesis. So did they recognize what we wanted them to? Were they able to analyze those clues and come up with a hypothesis? That's where we are. Same objective. I want them to keep, this is what I'm trying to look for. So prioritize findings that might bring the greatest risk for the clients and assign urgency to them. That's what I want them to do in this 3rd step. Okay, so this is the 3 of 6 questions on the case study. And you see the little squirrels there because I want you to make sure that you're staying focused on the objective for element 3. So make sure you've got one overall objective for the question and then a different objective for each one of those 6 parts of the case study. Okay, so this is what the objective was for this one. It doesn't matter that you know that, but element 3 is going to ask things like this. So this is something that applies to all case studies. So of these cues and assessments, what are some conditions that might be occurring that match several of these cues? This is what we're asking ourselves as you're writing the question. Do we know what condition might be at risk for the client based on the gathered data? This is what we're looking at in element 3. So when you're writing your case study, ask yourself those 2 questions, and it's going to help focus you and keep you on task with that objective. So these are the types of questions that you could use for element 3. This is the brands that we have there. And now, this is the same slide. You see, we've got a real similar format here, right? These are the element 3 questions I ask myself when I'm writing this 3rd element question for it. Asking things like, which condition is the client's highest risk and why? Which problem should the nurse address first? The nurse determines client is at risk for experiencing blank as a result of blank. That could be a drag and drop. The nurse identifies the priority client problems as blank, blank, and blank, drag and drop. Flows. Okay, so how would I use this as a faculty writing this question? Well, I'm going to pick which one of those 4 bolded statements I want to use for the last sentence for the stem of the question. And the questions that are in the lighter writing that are not bolded, that's what I'm going to ask myself to actually write the case study. So this is a way to kind of hold your hand through it. And when you think like, I don't have the bandwidth to do this, I promise this will help you stay the course and you'll be able to produce these questions. And the best way to write questions is often in a group. If you can find some good work buddies that you work well with, it's a great way to write questions. And of course, you always want multiple eyes looking at your questions because these have so many different moving parts. So element 3, these are the questions I would recommend. These are the questions I use when I'm writing element 3. So if I can do it, anybody can do it. Now with case sample 1, let's take a look at what it looks like. Remember, that would be this patient who had hypoglycemia before. We're taking a look at that. This is a drop-down rationale. You see what these are going to look like. I would need to write 3 options for each one of these blanks. Okay, so that's really what I'm looking for. A drop-down rationale. The question text would be like this. The nurse determines the client is possibly experiencing a blank 1, 3 options, as evidenced by blank 2, those 3 options. Hypertension, cholesterol levels, and high blood glucose is obviously the correct answer. So on yours, while we're in element 3, write a question that says the nurse determines the client is possibly experiencing a blank as evidenced by blank. And if you're really tracking with us, go ahead and write some options there. So you have kind of start the process when you go back and finish this case study. Okay, I'm just going to show you another example on what you can do in element 3. And this was with our, this is with our one with the infection control. So what I want the student to be able to do here, the objective, is I want them to decide which precaution is required and why they made that decision. That's a pretty tall order. I told you, students hate these, but there's precautions questions, but you'll get it. Here's the background. Don't waste your time reading that for this specific one. Just know that on yours, you would have some background to the question. And then what you're going to look to do is to make sure that you've written a question. We're going to use a drop-down rationale question. So just like the other one, the question text would be something like, the nurse will use blank precautions when providing care to this client because. Okay, so this is the rationale. Instead of them reading rationales after they take a question, they're having to recognize the rationale for doing what they're doing. Okay. So space 1, here's what we picked. Look, this would be like an easy question for us to write because it's going to be the same, right? Context, standard, droplet, neutropenic. Those are just the basic forms of precautions. But look at 2. The options are different. The client is HIV positive. The client has food poisoning. The client is not contagious. The client's white blood cell count is low. So here's an example of a little bit more complicated, right? This has some different answers, but you have the opportunity to do either one. Takeaway from this is it's a drop down. You're going to have to write multiple options for space 1, space 2, and you're thinking about how can I drive this student to think about why they're doing what they're doing. Did they recognize the right cues? Were they able to analyze and put them together so they can prioritize this hypothesis? And prioritizing hypothesis is they're choosing why they should do what they're doing. So that would be your goal for this one. Remember, I've shown you 2 cases. That's the only reason why I'm showing you in this. There's no magic in this. I just want to show you what it could look like for something like hyperglycemia and what it could look like for precautions. But what we really care about is, what do you want it to look like for your case study? So take a couple seconds, about 20, and write down what you'd like to do in your case study. Okay, so we've made it for the first 3. Now we're on element 4, and this is where you're going to generate solutions. We're checking to see if the student can actually generate solutions. So we're in that 4th box of the NCSBN clinical judgment measurement model. We're now here, back to there's our squirrel right there hanging out upside down. What's our objective? What do I want to accomplish on this step? So in this one, an example is we want you to identify the possible actions or solutions that they figured out from the priorities that they understood in the other elements. So we're asking them to think about, now, what do? You talked about cues that seemed weird. You put them together to develop a hypothesis. Now, what do you do about it? And so we're wanting you to figure out what are the actions as a student you'll do. So the students will need to think about what they should be doing, like, plan of care, and you want them to be thinking and anticipating what they're going to be doing in this part of the patient's care. So that's what we want them to be doing in element 4. That's what we're testing. These are the types of questions that are great choices for that. Now, this is examples of the questions that I would use when I'm writing these. The bolded ones are the ones that I pick first, like, which one of these do I want to be my last step, that last sentence in the stem of my question? And then the light gray ones are the questions that I would ask myself. Now, of course, we can't get all this done and to write a complete case study. And, we could spend 4 hours together or 8 hours together writing a case study. But remember, Sigma is so generous in having this recording available to you. You can go back and take a look at that the next time you're finishing up your case study. But remember, this is generating solutions. So this is what it would look like for something like case sample number 1. So in this one, we're going to use a multiple response, but they know the number. So which 5 interventions does a nurse anticipate are needed for this client's immediate plan of care? And we have 10 for them to pick from. Now, when they pick them, you can see which ones are the correct answer. Write yourself a note in this section. Do you want to use this type of question where you want to use a multiple response that you tell them the number? Or like with this one, and we'll use the second case study as an example, would you like to do a matrix multiple choice? So right now, the only decision I want you to make is, do you want to use something that is like this one, a multiple response where you tell them the number and you just have a list of them like that? Or for your case study, would you prefer to use a matrix that looks like this? So you would have interventions on the left, and you would have anticipated or not anticipated. So whether you use this or not, just write yourself a quick note. Hey, great option for element 4, interventions. Do you anticipate they would do that or not anticipate? Just put the headings, and you can go back and fill that in later, or you can use it on your case study when you go back and finish it out. So that's element 4. You see how we're kind of picking up speed, right? Because you're getting familiar with the tools and the strategies we're sharing with you. So hopefully it's making more sense. Hey, if you wouldn't mind, if we're going at a good pace for you and this is making sense to you, would you mind just sending an emoji, like a heart emoji or something onto the screen so that I can tell? I feel like I'm flying a little bit blind here. So, oh, yay. Okay, thank you. Thank you. That means a lot to me. Okay. The last thing I'd ever want to do is to bore my colleagues. I do not want to do that and not use your time well. Okay. Element 5 of 6. Here's what we got here. Take action. So we're in that 5th box. We want you to take action. So you know who's coming up? Squirrel. Yes, there he is. What is your objective for this one, for step 5? We want them to choose the right actions to take from the plan of care that they just identified back there in the previous step. So we're looking from the plan of care, what they organize, what actions need to be taken. So think about these things. What should be done? Should we teach the client? Should we give them medication? Should we adjust their position, check their vital signs, give them a tube, request a medication, get them ready for surgery? Those are just examples. And I use those as, again, to kind of stimulate my brain to think like, oh yeah, here's some options that we can do that. So what are the best types of questions to do for this? There you go. These are the best ones for element 5. These are the questions I would ask myself. First, I pick which bold one do I want to go with? And then I would know that I would further ask myself those questions that are not bolded to help me continue to write this part of the case study. So which education or teaching does the client need? Which interventions will need to be monitored? For each client, click to specify the nursing interventions that is specific for the client. That's a multiple response grouping type of question. Okay, so those will drive how you do it. Now, in this one, we're going to show you some examples, again, from the case study. That's not the point. I just want you to see what it would look like, not try and get the question right, because I know all of us want to always answer the question. But here's the text. Hey, the client is ready for discharge and the nurse performs teaching. For each teaching subject provided by the nurse, click to specify the teaching intervention that is applicable for the client. Ooh, that's a good question. Write yourself some notes on that because you know we want them to be good educators. But this is just one way that you could do this. So you can jot yourself some quick notes or come back later and take a look at it. But on this one, we've got diet and what are we looking for? And they just click in the box. So see these coming through? The subjects would be teaching, diet, exercise and activity, glucometer use, and medications. So those are the subjects. And should this intervention, does it line up? Is that what they should do? This is called a multiple response grouping question. Hey, aren't you guys glad you've already taken the NCLEX? I know I am, and real glad I don't ever have to take it again. That's fabulous. So let's take a look at another example from our one about precautions, infection precautions. So we've got a little bit of a client background to think about there. Yeah, I see someone feels my pain with me. And so I'm going to do this as a select all that apply question, but this is a multiple response, select all that apply question. Yeah, these are old school. We've seen these before. So woohoo! I think sometimes these are much easier to write than a 4-option multiple choice one. So they just look something like this. Which actions does the nurse implement to follow safe injection practices using standard precautions? Select all that apply. You could do those in your sleep. You've done them a million times. So That's another way that you could write a question for element 5. So you've got this select all that apply, and look how beautifully I'm scanning back there. Or you could do this one, which is a little fancier, and it's going to take you a little bit longer to write, but it's a great option to use a multiple response grouping question. Okay, we are coming up to number 6. So we're going back through these again. Element 6 is evaluate actions. So back to our model, you'll see that we've moved all the way over to that 6th box. So keeping it real, keeping the objective. There's my squirrel friend. Am I sticking to my overall plan? And am I meeting the objective for this point 6? I got to evaluate my actions here because students are going to look at and see what are the results of what I did. Yes, I know that you understand what it means to evaluate their actions, but that's question or that statement is there to remind me as I'm writing the question to do that. So here's an option. Before or after discharge, how do we know if the actions provided, and this is what I'd ask myself. You ask, are they successful or not? Are they understood or not understood? Now, that question I've seen students really struggle with when you ask the question, the last part says, which patient statement indicates the need for further teaching by the nurse? They will invariably miss that they're looking for the wrong or unsafe answer when they're just learning how to do that drive. So here, that's a way to say that. Is it understood or not understood? That would mean if it's not understood, you're looking for the client, the nurse, to do more teaching for the client. So again, on this question, right underneath the squirrel, these are the things I would ask myself when I'm starting to write element 6. Do I want to look at if the interventions were successful or not, if they were understood or not understood? That would be the teaching question. Do I want to look for, does it show sufficient teaching, or they require more teaching? Same kind of thing, just different words. And how I help the client. Are they better or are they worse? That's what, will they be able to recognize that? And so these are the question types. Again, we're just showing you one line at a time of the one that we did. Here's my let's fight decision fatigue questions. I would think about which planned interventions were successful or unsuccessful. Is the client better, worse, no change, need revising treatment? That's a killer way to do that question. Or click to highlight the blank results in the table that indicate improvement in the client's condition from the treatment for blank. Okay, so the first part, indicate improvement, that should be relatively more straightforward. They should be able to recognize when things are better. But the last part, from the treatment for, so that it will add a really interesting twitch to see how deeply they can do this last part, this element 6. So let's take a look at what it looked like for mine and our examples. And I would like you to think about how you could do this for yours. So if I was adding this to my case study, I just write the headings. Client statements, understanding, no understanding, because that would remind you how to do it. So it's going to be simple things like this. I will add oatmeal to my diet. I will record a glucometer reading. You see those simple patient statements, but this is a really straightforward and easy way to write element 6. And we are just about through the case study. Let me show you one more with a case study sample number 2. You've got a little bit of the background there. You're thinking about it. Here's an example of a different type of question text for element 6. So which 3 behaviors observed by the nurse manager show that the teaching was effective? So this is a multiple response with a number, MRN. And if you think I have all this memorized, I have another sticky note on my desk that explains what all these are too, because I get them all twisted around in my head. And so on this, they've told me exactly how many questions you want, how many answers you want to this question. So there you have it. Now I'm going to give you just a minute to absorb that. This took us an hour to walk through together. And now we're going to do some additional question types, bow tie, etc. But I'm going to be quiet and go off camera for just a minute to allow you to wrap up your notes, write notes to yourself that you want to do and that you want to follow up on. And I will see you after our 60-second break. You like that fancy going way to break your thumb on the webcam? Yeah, I do my best. Hey, on this one, there's one other tip I want to give you. When you're helping your students be successful in the NCLEX, you see in this question text, the student is the nurse manager in this one. So just a quick tip in teaching them management of care, always ask them to ask themselves, who am I in the question? Who else is in the question, and do I supervise or delegate them? Because that is something that students really struggle with. And so if they recognize that, if it's RN to RN, you don't correct a peer. You have to follow the chain of command, go to the charge nurse or the nurse manager and have them correct the peer. I don't correct somebody from housekeeping because I don't directly delegate or supervise the housekeeper. So that's just a little side tip. If you look really smart in front of your students, because that will help them. I see so many students struggle with the management of care questions, and really they're straightforward. If they just remember who they are in the question, who else is in the question, do they delegate or supervise them, and you are good to go. Okay, ready for a bow tie? We're going to take a look at this. Now, in a bow tie question, you can have a combination of all 6 of those elements. That's why we did the case study first, so we could kind of walk through those and you could see examples of what those are. So our objective, again, keep it in the forefront. And for this example, what we're looking for is students should be able to utilize all 6 skills within the clinical judgment model. Recognize cues, analyze cues, prioritize hypotheses, you know what they are. So this includes the ability that they're going to do all those steps. Okay, and again, if you have this on your desk somewhere, no shame, you are my people. That was just great to have a reference when things are getting a little crazy. So this is what you want to make sure that in this bow tie, you're thinking about all 6 of these, right? You're thinking about, how am I going to walk through these and put these neatly into a bow tie type question. Now, what a bow tie looks like, I'm sure you're pretty familiar, but you want the student to be able to recognize problems, know what actions to take, know what to monitor, whatever we're taking a look at, whether a patient is dehydrated from vomiting, whether the patient is pregnant, whatever the thing is. When I teach this to students and how to do it, I'll show you kind of the steps that I use with them, because it's the steps I use when I write it. But in a bow tie, they're going to be confronted with this type of thing, what a bow tie story looks like. They're going to have these tabs. Be sure to reassure them, guys, you can go back and forth in these tabs as many times as you want to. So don't panic, but use your time wisely as you're reading through. Look for anything that's abnormal. So if you see a number, ask yourself, is it high, low, or normal? If you see a type of assessment, ask yourself if it's normal or abnormal. If the patient says anything to you, that's important. So keep that as a focus of the question. Those are the things that you're looking for. And we're going to do another webinar with our students at Lecturio to help them understand keywords in the questions, things that they should always look for in NCLEX questions. So this is what a bow tie is going to look like as far as the information that will be presented to them. But they're going to end up completing the diagram, which is the bow tie. Remember, it's this triangle on the left, middle tie, and then on the right. So we want them to drag and drop these choices, and they're going to specify which condition the patient is likely experiencing, what they should do, and what they should monitor. So in an example of a bow tie, in the middle, one of the ways that you can do that is the middle part is the condition they're most likely experiencing. Okay, this is not as complex, right? When you think about with what we're talking about with objectives, what condition do you want? Use that same case study that you just did. What condition would you want them to recognize? What's most important? I talked about CHF, like I want them to recognize fluid volume overload. So that might be a condition, but what condition would work for yours? Now on the left side is going to be actions that they should take. Now we kind of stretched out this bow tie so you see it a little more, but actions to take are going to be the 2 most important things for them to do for a patient with this condition, and this is what they should monitor. So the more you can help your students understand, hey, the middle is always going to be like, what is going on? What is up with the patient? The left side is going to be what you should do or what those options are. And the last side is going to be what you should do to keep that patient safe or what you should monitor. So when I'm writing one of these questions, I prefer to start in the middle. Now, when I have beginning students, I have them go left to right just to stay systematic, but then I tell them it's okay to start with the potential condition, the one in the middle, and then take a look at the actions to take and see what makes sense. But they're just going to have to practice these. This question takes, I think, more focus because there's so many moving parts to it. At least in the case study, it's one question at a time. But in this, you've got like 3 parts of this question. So action to take, we have some options here, potential conditions. Again, what we chose and wrote as a case study does not matter. I just want you to think when you're writing a bow tie in your notes, just write yourself a quick note, actions to take, potential conditions, parameters to monitor. Pick a condition that lines up with your case study. What's a condition you would want to have them see? And just write that one out. And then you can go back in and flesh it out or fill it out later in all your spare time. Okay, so that's a bow tie question. In some ways, they can be a little easier to write, but I would start with writing the condition, and then I would write the actions and the parameters. I don't care if you do the parameters first or the actions to take, but I would start with the right answer first, and now be thinking in the mind of a student. What else could they misinterpret in this question? What else might they miss? What might they confuse this? What other condition has similar symptoms? And I would start, that's how I'd write the next one. And that's how I would write the next one and just fill those out. I think bow ties can take a while to write because you've got to make sure that there's 2 that are clearly the best option and you can prove to yourself why they are. So writing rationales for why you've selected right answers is the best way to get a good question. If you skip that step, if you don't write the rationales why these are the actions to take and why these are not the actions to take, or why these are the parameters to monitor, or these are not the parameters to monitor, you're likely going to miss something. And I think all of us have had the experience, or at least I have. You can let me know with a thumbs up if you have. You've slaved over a test question and you thought it was chef's kiss beautiful. And then you give it to students and they come back and go, hey, couldn't this one be the right answer too? And you're like, damn it. They're like, they really are like squirrels. They find that stuff. So making yourself write rationales will help minimize that. But yes, I'm so glad to know, yes, my peeps were on this call. Oh, there's nothing stinkier than that. You think like, well, that was worth my time at 2 o'clock in the morning. Maybe that was part of the problem. So we've done a case study. We've gone through those 6 elements. Then we did a bow tie, and hopefully you have on your bow tie, you've got like the condition that you want them to recognize from your topic that you picked at the beginning. Now we're going to do a trend. And this is the one that people were so scared about because we knew there's going to be tabs in it. There's tabs in most all of them, but this one was like, oh my gosh, students are going to have to read charting. But it's not as bad as it sounds when you take a look at it. And honestly, if I'm in the hospital or I have a loved one in the hospital, this is what I want them to see. I hate those questions that just give you like this tiniest snapshot and say, what do you do? Are not really measuring what we want to measure. So this being able to see things over time, I think is brilliant. Now this, I was so proud of myself because I put the squirrel on her stethoscope. You have to celebrate the little things in life, but we're wanting them to answer questions that are based off what they've observed of a patient's progression or what things have happened over the time. They could get better, they could get worse. So you're looking at either maybe client needs, you're looking at interventions, maybe looking at what you expect the healthcare provider to order based on what they've observed. Okay, so this is our 3rd big kind of question here. So what does a trend story look like? It looks exhausting, okay, because you got to put a lot of information out here. You got nurses' notes, history and physical. So these also take some time to write because you have to have a fair amount of information in there. You're also going to want to have these examples here where you see that you've got what the patient looks like, what their pulse is, what a grimace, just assessment information, scored 0, 1 to 2. This is going to look very similar to what you've seen in assessments and things, but you could have both of these tabs here. You have this assessment information. So how do you take that and write a trend question? Well, what makes a trend question a trend is all this information. It's the same patient, but information from different periods of time, different parts of the chart, different kinds of assessment. That's what makes it a trend question. Now, what you do to write that trend question, drop down close, is fine. You could definitely do that. And here, my goal in this one, we're going to give an example. Like, we want them to be able to decide based on what they've seen the trend over a period of time, what they should do next. So what are the kind of things you can ask yourself? Well, you could write a question like this. The nurse charts the infant's APGAR score as 1, which I know you women's health and pediatric people, they're like, that's the APGAR scale. Then you can chart the infant's APGAR score as blank at 1 minute and blank at 5 minutes, and the infant will need blank and blank. So when you write this, you obviously got to make sure that you go back and make sure all that information is in your study. But I kind of like to write the trend question first, kind of roughly know what it is, and then I can flesh out my story to make sure that they both line up. That's obviously really important on what you want to do. Now, how it will look to the student is, you see that on the left, it's going to have a little drop down close. When I'm writing this question, I use my worksheet, and I know that I've got 4 blanks. So I have 3 options in each one. 1 is the correct answer, and the other 2 are the distractors. Okay, so that's much easier said. That one is going to take some time because that is like a multiple choice question on crystal meth. That is quite a crazy question that you have there. So write yourself just some quick notes. If you want to do a trend example, use that question text, and you've got that there just as like this is a real straightforward example of it. Then tell yourself space 1, space 2, space 3, space 4. You can go back and write it later. You can flesh it out. Now, I just have a quick poll question. We just are trying to find out if people are aware that we actually have an NCLEX review, a course at Lecturial. So if you can just tell us yes or no in the chat, just a Y or an N, remember, save your time, save your space there. Just let us know if you're aware that our company Lecturio, who's hosting this, has an actual NCLEX review with next gen content and references there for you. So we've got the complete package. Now, a reference is here. We've got them. So if you need them, there they are, if you'd like to have them. But I'm going to wrap up this part before we go to the questions, because I want you to be thinking about, we teach our students to be systematic in how they answer questions, be systematic in how you outline and write them, and you're going to have solid questions. And don't expect your first ones to be amazing. That you do it is amazing, but you'll get better at them as you write them and edit them. Remember, practice for you is just as important in writing the questions as students practicing questions, taking them. So keep your eye on the ball. Remember the purpose of each element. What is the goal in 1? And what does it look like? What questions should you ask yourself when you're doing that? All the way through 2, 3, 4, 5, and 6. Because remember, that objective, the squirrel friend is back. Because that is the best way to avoid getting lost in the weeds, is to make sure that you have an overall objective for the case study or the question. But with a case study, you want an overall objective and then a specific objective that aligns up with each one of the 6 elements. And the 5th thing really isn't a conclusion to this, but I would love to come to your school virtually or in person to do some additional workshops on whatever you like, because I just like hanging out with faculty. People that make it through with nursing students, I think you're warriors. So I'm going to put my information right here for you, and you are welcome to contact me if you're interested in us coming and talking to you and doing some more training on item analysis or writing things or test quoting. I would love to come virtually or in person to your school. That again is my contact information. We also have, if you want some free resources, we have a QR code you can just take a picture of with your screen. And Remy, if you wouldn't mind, if you would put my, if you can make sure those links are in the chat so people can see them easier, that would be great. Because it's hard to write all that down. It's the end of the day. Now, here's the QR codes. And so I'm going to leave those up on the screen for you. And then I'm going to stop sharing my screen for just a second so the Sigma people can come back at the end and do that and share their screen. So hang on, what's going to look, it's not going to look pretty, but we will get this where I can stop sharing my screen. But see if you have it. I would like to know if you have any questions.
We do have some questions for you. Uh,
Fantastic.
a couple came in, Rhonda, about scoring and grading of the questions. And I know that this has been confusing for some individuals regarding the multiple responses for select all that apply. How is that scored? And then if a student adds or omits one check, how does that look in the scoring process on the Next Gen NCLEX?
Okay, that's a really great question. You know, we're all curious. And remember, this was like the biggest bone of contention when we started hearing about this. Like, how are you all going to score this? Now, they've come out with some really detailed things. And so if you want to contact me, I will send that report to you because it is pretty complex and they've got it laid out for you exactly how they're doing it. So they do have that all figured out. It's not going to be in something that's going to make much sense to the students because they're wanting to know, like, if I was a student, how many can I miss and still be okay? Or how many can I miss and still be on that? So if you want more info, contact me at that email address and I can point you to the spot in the website where they explain how they're going to do that. And they're talking about logits and everything else, all those weird numbers, but they can show you that. So not a great answer to be able to give your students, definitely not a great answer to give the colleague, except be happy to send you the link from the guys who wrote it and decided how to do it. And it's just a lot of statistical language. So just encourage your students, do your best. And if you're trying to do scoring at your institution, that's probably going to be tough to do until the learning management systems can catch up. So if you're wanting to know a simple way that, hey, if I write this question, how am I going to score it? That's something that we could put some brain thinking into and come up with a simple way for you to score it if you're doing it on your own. Because that may have been what your question was originating, like, hey, how do I score this and give students credit for it or not give them credit for it? So if that was your question, please let us know and we'll create a short guide for you on how to do that. And how do you time the case studies? Well, it really depends on the student, where they are in the program. Are they newbies? Are these freshmen or sophomores? Oh, Victoria, thank you so much. You have, Canadian. How fun. Yes, I'm planning on coming to Canada, so I'd love to hop on and see you at your school. How you time it depends on where your students are. If they haven't done many of these or they're very young in your program, don't time them. Do them in class as an activity. First, have them do it by themselves and then have them do it as a group one. Now, by the time I get to my seniors and I'm running them through things, then I do put a time limit on it and I expect them to be able to work through it. But still, I don't want to focus on the time as much as I want them to focus on learning the strategy. So it's really not fantastic to use like on a timed exam because they can get so lost in the weeds. I would use these more to help them understand the process for answering these questions. So that was a pretty roundabout answer, but I would try to avoid time because you want to get them to get the process. And then as you're doing that with your systems, then you can slowly add that in. And if you would like me to spell that out more, just let me know and we can just shoot us a quick email and I can write that out. Hey, it means so much to me that you guys, I thank you that you take the time to write that because you know what pressure that is to talk to faculty because we've all been to bad webinars and I do not want to be the one who gives you a bad webinar. All right. Thank you for coming. And hey, please stay in touch. I do lots of webinars, love hanging out with faculty and with nursing students. Would love to be with you. Now I'm going to go off camera and turn this back over. Thank you to Sigma. We have loved partnering with them. So I'll let you guys come back on camera and close us out.
Thank you so much, Rhonda. This has been wonderful, and you can see the feedback has been great. So we want to thank you for sharing all of this information with us today. And Sigma is grateful that you took the time not only to share this information with our audience, but for this partnership that we have with Lecturio to bring this webinar series to you. We hope that you enjoyed this webinar. As a reminder, 1 week from today, you'll be emailed a link with the evaluation for you to obtain your Nursing Continuing Professional Development Certificate. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars are freely available on the Sigma repository. Thank you for joining us, and we hope to see you at the next webinar in the series of Nursing Faculty Prep webinar series, proudly sponsored by Lecturio. We'll see you soon. Have a great day.